Stop, Claire Donovan's voice wasn't loud. It didn't need to be. Inside Operating Room 6 at Pikes Peak Regional Medical Center, every sound suddenly seemed to disappear. The surgical lights hung over the unconscious patient like twin moons. Monitors pulsed with steady rhythms. Stainless steel instruments gleamed on the tray beside the scrub nurse. Chief Trauma Surgeon Dr. Ethan Mercer looked up from the patient, irritation spreading across his face. "What is it now?" Claire kept her eyes on the monitor. "Before you make the first incision, I'd like another look at his arterial waveform." Mercer sighed dramatically. "We've reviewed every scan twice." "I know, so what changed?" "I don't know yet." Mercer folded his arms. "That's not an answer." Claire stepped closer without touching anything sterile. "The waveform is different from when he came out of imaging." The anesthesiologist glanced at the monitor. "I don't see anything concerning." Claire nodded respectfully. "It isn't obvious." Mercer gave a short laugh. "Exactly." Several members of the surgical team shifted awkwardly. Mercer looked around the room. "Everyone here has spent years learning to distinguish instinct from evidence." His eyes settled on Claire. "Stick to nursing and let surgeons handle surgery." A few uncomfortable smiles appeared. Nobody laughed. Claire didn't respond. She simply kept staring at the green line moving across the monitor. Something wasn't right. She couldn't explain it. Not yet. Outside the operating suite, snow fell harder against the hospital windows. Emergency helicopters had already been grounded. Road conditions were deteriorating by the minute. Inside the hospital, however, everything continued with mechanical precision. Or at least it appeared to. The patient lying on the table wasn't just another trauma case. Judge Benjamin Wallace, 68, federal judge, scheduled to begin the state's largest public corruption trial less than 24 hours later. 3 days earlier, he had collapsed while hiking near Garden of the Gods. Initial imaging suggested internal bleeding caused by blunt abdominal trauma after an unnoticed fall. The surgery should have been straightforward, should have. Claire had cared for him in the ICU overnight. She had watched every heartbeat. Every blood pressure change, every lab result. She knew his condition almost as well as anyone, and something still refused to fit. "Knife." Mercer extended his hand. The scrub nurse placed the scalpel into his palm. Claire felt her pulse quicken. She replayed every observation from the past 12 hours. Stable blood pressure. Then unexplained drops, normal imaging, yet worsening pain, strong pulses, then subtle color changes, nothing individually alarming together. They formed a pattern, one she hadn't seen in years. No, not years, almost a decade. A mountain rescue volunteer deployment. One patient, one impossible diagnosis. One night she'd never forgotten, but that couldn't be happening here, could it? Mercer positioned the blade. Incision. The scalpel touched skin. 5 seconds passed. 10. Then the arterial pressure alarm chirped. The anesthesiologist frowned. Pressure's drifting. Mercer didn't look up. Increase fluids. Already doing it. The blood pressure continued falling. 110, 98, 90. Claire's stomach tightened. Too fast, far too fast. Mercer continued calmly. Normal response. Claire watched the waveform flatten slightly. There, again, the tiny distortion. Exactly where she'd seen it before. "Doctor," Mercer didn't answer. "I really think we should stop." This time his head snapped toward her. "For what?" "I believe we're treating the wrong injury." Silence. Even the circulating nurse froze. Mercer stared at her. "Do you understand how serious that statement is?" "Yes." "Then tell me exactly what injury we're missing." Claire opened her mouth. Nothing came, not because she doubted herself, because she didn't yet have enough evidence. Only instinct. Mercer shook his head. "I won't delay surgery because of a feeling." He turned back. "Continue." Across the room, surgical resident Dr. Sophia Patel glanced between Mercer and Claire. She had worked with Claire before. The nurse rarely questioned physicians. When she did, there was usually a reason. Patel quietly checked the latest laboratory values. Hemoglobin, stable, electrolytes, normal, lactate, slightly higher than expected, nothing dramatic still. She looked again at the arterial tracing, then at Claire. Claire noticed. Neither woman said a word. 20 seconds later, the monitor screamed, blood pressure. 78, heart rate climbing, oxygen saturation beginning to drift. The anesthesiologist looked up sharply. "He's crashing." Mercer immediately stopped operating. Suction. Retractors, more blood. The room exploded into controlled motion. Claire moved without waiting for instructions. She adjusted IV tubing, checked medication pumps, verified transfusion lines. Everything functioned perfectly, which made no sense. The equipment wasn't failing. The patient was. "Where's the bleeding?" Mercer demanded. "Minimal in the field," the resident answered. "It should be worse." "It isn't." Mercer frowned. "Ultrasound." Portable imaging rolled beside the table. Everyone watched the screen, nothing. No obvious explanation. The room became eerily quiet. Mercer whispered almost to himself, "That's impossible." Claire already knew why, because everyone was looking exactly where the original scans had pointed, not where the problem had actually begun. Marcus Bell, the charge nurse, stepped beside Claire. "You've seen something." She nodded once. "I think so." "You sure?" "No," Marcus frowned. "You usually are." Claire looked back toward the patient. "I've only seen this once." "When?" "9 years ago." "Where?" She hesitated. "Volunteer mountain rescue." Marcus' expression changed. "You never told anyone." "I didn't think I'd ever need to." Mercer overheard enough to turn around. "If there's something relevant, now would be the time." Claire inhaled slowly. "The blood loss doesn't match the pressure collapse. We know that." The scans showed where blood collected. "Correct, but not necessarily where it started." Mercer's eyes narrowed. "What are you suggesting?" "I'm suggesting we're chasing the result." She looked directly at him. Instead of the source, nobody spoke. The monitor continued its relentless alarms. Outside, snow hammered the hospital roof. Inside, time suddenly felt much shorter. Mercer stared at Claire longer than before, for the first time since entering the operating room. He wasn't looking at her like an interruption. He was looking at her like a possibility. Then another alarm erupted. The patient's blood pressure plunged again, lower than before. Mercer looked back at the surgical field, then at the monitor, then back at Claire. His confidence didn't disappear, but something else appeared beside it: doubt. And in an operating room, doubt can either save a life or cost one. For one long second, nobody moved. The only sounds in operating room 6 were the rhythmic hiss of the ventilator and the increasingly urgent alarms echoing from the patient's monitor. "Doctor." Ethan Mercer forced himself to breathe. "Status." The anesthesiologist glanced between 3 different displays. Pressure 68/40, heart rate 134. He's compensating, but not for much longer. Mercer looked into the open surgical field again. "There should be far more blood, doctor." Sophia Patel nodded uneasily. "I agree." Mercer shot her a look. "You agree with what?" "The patient's unstable, but the operative field doesn't explain it." It was the first time one of his own surgeons had questioned the original diagnosis. Claire didn't celebrate. She kept watching the monitor. The numbers still bothered her less than the pattern behind them. The blood pressure would crash, recover slightly, crash again. Each recovery was shorter than the last, almost as if something deep inside the body was opening, then briefly sealing itself again. Like a door slamming in a hurricane, she had seen that rhythm before, just once, 9 years earlier. "Claire." Marcus Bell's quiet voice broke through her thoughts. "You've gone somewhere." She blinked. "The mountains." Marcus frowned. "The rescue?" She nodded. "We were called to a climbing accident." The man looked stable. Every scan looked reassuring. "So what happened?" Claire swallowed. "He died before sunrise." Marcus studied her face. "You think this is the same thing?" "I pray it isn't." Mercer extended his gloved hand. "More suction." The surgical assistant complied immediately. The cavity remained unexpectedly clean, too clean. Mercer hated mysteries. The human body followed rules. Years of experience had taught him that. Symptoms pointed to causes. Causes produced evidence. Evidence led to treatment. Today's patient refused to obey those rules. He didn't like it, not one bit. Claire quietly walked toward the digital chart displayed beside the anesthesia station. Every recorded vital sign from the previous 18 hours appeared on the screen. She scrolled backwards: 1 hour, 3 hours, 6, then overnight, there. A tiny change, barely noticeable. She compared it with the live monitor. Her heartbeat quickened. The arterial waveform hadn't changed today. It had begun changing nearly 12 hours earlier. Nobody noticed because each change was microscopic. Together, they formed a staircase. Slow, steady, deadly. Dr. Patel. The resident stepped beside her. "What are you seeing?" Claire pointed without touching the monitor. "Look at the spacing." Patel leaned closer. "The pulse pressure." "No, the recovery." Patel stared another few seconds, then her expression changed. "It keeps shortening." Claire nodded. "Exactly. If it continues, the next recovery won't happen." Patel looked toward Mercer. "He needs to know." Mercer listened without interrupting. When Patel finished, he crossed his arms. "Correlation isn't causation." Claire answered calmly. "I know, so what are you proposing?" "I'm proposing the bleeding isn't inside the abdominal cavity." Mercer's eyebrows rose. "Then where?" "I don't know yet." "That's twice you've admitted you don't know." Claire met his eyes. "I know what doesn't fit." Mercer looked frustrated. "And that's supposed to help me." It already has, he frowned. How? You stopped cutting. Nobody spoke. The words hung in the operating room. Mercer glanced down. She was right. For nearly 2 minutes he'd done nothing except search without realizing it. She had already changed the operation. The anesthesiologist interrupted. Pressures falling again. 62. Mercer inhaled sharply. More blood products. They're already running. Vasopressors. Started. Nothing changed. The monitor continued its relentless decline. Outside the operating suite, hospital CEO Lisa Hernandez walked quickly down the corridor. She'd been informed that a routine trauma operation involving Judge Wallace had become unexpectedly unstable. She stopped beside the observation window. Inside, she saw an operating room she barely recognized. Mercer wasn't operating. He was searching. Staff members who normally moved with effortless confidence now exchanged uncertain glances. Something had gone very wrong. Inside, Claire noticed another detail. The patient's fingertips, slightly darker, not blue, not pale, almost mottled. Her mind raced. Pressure swings, waveform changes, delayed capillary refill, intermittent collapse. The pieces were almost together, almost. Then another memory surfaced, the mountain rescue. The injured climber had whispered something before losing consciousness. It feels like, what had he said? She closed her eyes for one brief second. Come on, remember, Claire. Marcus touched her shoulder gently. You okay? She opened her eyes, the climber. What about him? He kept saying he felt pressure in his back. Marcus waited, and so did Judge Wallace. Patel looked over. He mentioned back pain in the emergency department. Claire nodded. They thought it was from the fall. Mercer overheard, so. Claire turned. What if the fall wasn't causing the injury? Mercer stared. What are you saying? What if it revealed one that was already developing? Before anyone could answer, every monitor in the operating room flickered, once, twice, then went black. The room froze. What happened? Mercer barked. A backup alarm immediately activated. Emergency power restored the essential equipment within seconds, but the main surgical display remained dark. The circulating nurse tried the touchscreen. Nothing. System won't reboot. Patel checked another monitor. The imaging server's offline. Mercer's jaw tightened. Get it. They're already responding. How long? No estimate. Mercer looked up at the blank screen. Every CT scan, every reconstruction, every image guiding the operation. Gone. The anesthesiologist broke the silence. We can't wait. Mercer knew he was right. Judge Wallace didn't have time for computer technicians. They would have to continue with what they remembered, and memory was a dangerous substitute for evidence. Claire stared at the dark monitor, then something caught her attention. A tiny notification appeared before disappearing. Data synchronization error, only for half a second. Most people never noticed. She did. Her pulse quickened. If the imaging hadn't synchronized correctly, what else hadn't transferred? Mercer. Her voice was calm. I don't think the scans were complete. He looked at her sharply. What? I think we were making decisions using incomplete data. Patel's eyes widened. Is that possible? Mercer didn't answer immediately. His confidence had begun to fracture, not because Claire had proven herself right, but because the operating room itself was beginning to support her doubts. He slowly looked from the blank imaging screen to the deteriorating patient, and finally back to the nurse he'd dismissed only minutes earlier. For the first time that morning, there was no sarcasm in his voice, only one quiet question. Claire, what exactly do you think we're missing? Claire didn't answer immediately, not because she was unsure, because saying it out loud would change everything. The operating room had already shifted from confidence to uncertainty. The wrong words now could send it into panic. She stepped toward the head of the table, her eyes never leaving Judge Wallace. I think we're looking at a secondary injury. Mercer frowned. Hidden where? I don't know the exact location. His jaw tightened. You still don't know? No, she took a slow breath. But I know its behavior. The room fell silent again. Claire pointed to the monitor. His pressure doesn't collapse randomly. She traced the rhythm in the air with her finger. It falls, partially recovers, then falls harder. The anesthesiologist looked back at the waveform. She was right. Claire continued. If this were simple blood loss, we'd expect a different pattern after transfusion. We've already given 4 units. His numbers should be responding. They aren't. Mercer folded his arms. So what's causing it? Claire looked directly at him. Something is temporarily cutting off circulation before releasing it again. Patel whispered almost to herself, like a valve. Claire nodded. Exactly. Mercer's mind raced. He mentally reviewed every image he'd seen that morning, every laboratory result, every physical finding. For the first time in years, he realized he wasn't thinking about proving himself right. He was trying to prove Claire wrong, and he couldn't, not with certainty. The distinction unsettled him. The hospital's IT supervisor rushed into the observation area outside the operating suite. Lisa Hernandez met him immediately. How long until imaging comes back? We're checking the server. What happened? There was a synchronization failure during overnight maintenance. Lisa stared at him. What does that mean? It means some operating rooms may have received cached image files instead of the complete studies. Her expression changed instantly. You're telling me the surgeons might not have been seeing the full scans? We don't know yet. Find out. He ran. Lisa turned toward the observation window. Inside that room, every second suddenly carried even greater weight. Back in the operating theater, Claire noticed Judge Wallace's left hand. His fingers twitched, not purposeful movement, a reflex, but enough to remind her of something she'd almost forgotten. The climber, 9 years earlier. She had been 29, volunteering with a mountain rescue medical team during her annual leave. The helicopter couldn't fly because of heavy winds. The injured climber had arrived 6 hours late. Multiple fractures, internal trauma, everyone focused on his abdomen exactly like today. She remembered helping the emergency physician. The man had looked stable until he wasn't. Blood pressure crashing, recovering, crashing again. The physician had stared at the monitor before quietly saying words she'd never forgotten. When the numbers make no sense, stop chasing the numbers. Chase the pattern. They discovered an extremely rare vascular injury hidden behind other trauma. They repaired it, barely in time. Claire had never encountered another case. Until now, she opened her eyes. I've seen this before. Mercer looked up. Where? She told him. The room listened. Nobody interrupted. When she finished, Mercer asked one question. How similar? Claire answered honestly. Not identical. But close enough that I can't ignore it. Patel stepped beside Mercer. If she's even partially right, continuing this approach could be making things worse. Mercer looked back into the surgical field. His instincts resisted. His experience argued against changing course. Yet experience had also taught him something else. Medicine punished pride, sometimes permanently. He slowly removed his hands from the patient. Everyone stop. The operating room froze. Claire exhaled quietly. It wasn't victory, it was opportunity. Mercer pointed toward the ultrasound. Scan again. Different angle, different approach. The probe moved carefully. The image appeared, fuzzy, incomplete. Then Patel leaned closer. Wait, she adjusted the gain. There. Mercer stared, a shadow, not where they expected, not where the original scans had suggested. Claire felt her pulse quicken. That's it. Mercer whispered, impossible. The anesthesiologist interrupted. Pressure's 58. Mercer snapped back into action. We're changing the plan. Patel nodded immediately. The surgical team repositioned, instruments changed, retractors moved. Everything happened with astonishing speed. This time they weren't searching where the bleeding had collected, they were following where it began. For nearly 3 minutes, hope returned. The pressure stabilized slightly. The waveform improved. Marcus smiled behind his mask. We're getting somewhere. Claire didn't answer. She still had a bad feeling. Something remained unfinished. Mercer carefully exposed another section of tissue. There, Patel's eyes widened. I see it, a damaged vessel, partially concealed, intermittently collapsing, exactly consistent with Claire's theory. Mercer looked across the table. He didn't smile. He simply nodded once. It was the closest thing to an apology possible in the middle of surgery. Claire returned the nod, nothing more. There would be time for words later. Right now, the patient still needed them. Mercer reached for a vascular clamp. Clamp. The scrub nurse placed it into his hand. He moved carefully, slowly, steadily. Then the damaged vessel ruptured. A violent surge of blood flooded the surgical field. Massive bleed, suction, more suction. The operating room exploded into motion. Mercer reacted instantly, pressing firmly against the rupture. Pressure. Blood covered his gloves almost instantly. The suction struggled to keep up. The anesthesiologist shouted over the alarms. Pressure's 40, transfusion wide open. Marcus handed instrument after instrument without needing instructions. Claire coordinated medications, blood products, and communication simultaneously. No one wasted a movement. Then it happened. Mercer reached awkwardly for another clamp. His right hand slipped against the blood-soaked instrument. The scalpel lying beside the incision sliced across the base of his thumb. He barely reacted, but Claire saw it immediately. Doctor, I'm fine. He kept working. Blood seeped inside his glove. Patel noticed too, your hand. I'm fine. He tried to reposition the clamp. His fingers trembled just enough. The clamp missed. Another burst of blood erupted. Mercer froze, not because of pain, because he realized what had happened. His dominant hand wasn't responding normally. Claire stepped closer. Ethan. It was the first time anyone in the room had used his first name. Look at your glove. He did. Blood filled it, not the patient's. His own. The cut wasn't catastrophic, but it was deep enough to reduce strength and precision. Exactly what a vascular repair demanded most. Mercer flexed his thumb. Pain shot through his hand. He closed his eyes for half a second. When he opened them again, the truth was unavoidable. He could continue, or he could give Judge Wallace the best chance to survive, not both. The room waited. Nobody dared speak. Finally, Mercer looked at Claire, then at Marcus, then at Patel. Snow continued pounding against the hospital windows. Dr. Noah Kim, the vascular specialist, was still trapped across town, his ambulance crawling through roads coated in ice. Every minute mattered. Mercer's voice was quieter than anyone had ever heard it. How long until Kim gets here? Marcus checked the latest update. At least 25 minutes. Mercer stared at the patient. 25 minutes was an eternity. He slowly removed his blood-soaked glove, looked at the injury, then looked directly at Claire for the first time in his career. He admitted he couldn't do this alone. His next words stunned everyone in the room. Claire, he swallowed. I need you to run this operating room until Dr. Kim gets here. Every eye turned toward the nurse who, less than an hour earlier, had been told to stick to nursing. For a heartbeat, no one moved. The words seemed too heavy to belong in the room. Claire looked at Dr. Ethan Mercer, searching his face to make sure she'd heard him correctly. He wasn't surrendering. He was making the hardest decision a surgeon could make, placing the patient's life ahead of his own pride. She gave a single nod. All right. There was no celebration, no triumphant glance, no satisfaction. Only responsibility. Claire stepped to the center of the operating room where she could see every monitor, every pair of hands, and every instrument. Her voice remained calm. Everyone listen. The room instinctively turned toward her. Nobody rushes. If we panic, we lose him. The words settled over the chaos like an anchor. Marcus, I'm with you. I need blood products tracked every 30 seconds. Already on it, Dr. Patel. Yes, your first assist until Dr. Kim arrives. Patel nodded immediately. Understood. Anesthesia. The physician looked up. I need every pressure change spoken aloud. Don't wait for me to ask. You'll have it. Scrub, ready. Prepare every vascular clamp we've got. They're coming. Within seconds, the room transformed. The frantic energy disappeared. People moved with purpose instead of urgency. Even Mercer noticed it. Claire wasn't ordering people, she was organizing them. There was a difference. Outside the observation window, CEO Lisa Hernandez watched in disbelief. Who's running the room? The operating supervisor answered quietly. Claire Donovan, the nurse? Yes. Lisa looked back through the glass. Nobody inside appeared confused. Nobody questioned Claire's instructions. If anything, the room looked calmer than it had 20 minutes earlier. Claire leaned toward Mercer. Can you maintain pressure? He flexed his injured hand. I can hold. That's all I need. She smiled reassuringly. Save your strength. Mercer looked at her for a moment. He realized she'd never once reminded anyone that she'd been right. Not once. Most people would have. Claire hadn't. The anesthesiologist called out. Pressure's climbing. 58. Claire nodded. Good. Heart rate 118. Oxygen 95. We're buying time. Marcus returned. 8 units transfused. Additional blood arriving. Claire checked the clock. Dr. Noah Kim had been delayed for almost 35 minutes. Every additional minute felt impossible. The hospital dispatcher's voice crackled through the speaker. Weather update. Emergency vehicles moving at reduced speed. Claire closed her eyes briefly. Come on, Noah, just get here. Suddenly, the monitor emitted a different alarm, not the blood pressure, not oxygen, cardiac rhythm. The heartbeat became irregular. Patel stared at the screen. That's new. Claire looked immediately. The rhythm wasn't random. The patient's heart was becoming irritable. His body had lost too much blood. If they couldn't repair the vessel soon, the heart itself would become the next problem. Mercer saw it too. We're running out of time. Claire answered honestly. I know. Another minute passed, then another. The operating room settled into an almost surreal rhythm. Orders, responses, alarms, silence, no wasted words. Every movement mattered. Claire noticed something she hadn't before. Mercer's injured hand was shaking more, not from fear, from fatigue. She quietly placed another assistant beside him. You don't have to prove anything. He looked at her. I know. For the first time in years. He actually meant it. Outside the hospital, Dr. Noah Kim gripped the steering wheel of the 4-wheel drive emergency vehicle. Snow covered the interstate like a frozen river. Visibility had dropped to less than 50 feet. His phone rested on speaker. ETA, the dispatcher answered, 12 minutes. Kim shook his head. Tell them to hold. I'm coming. Inside operating room 6. The lights flickered once, twice, then steadied. Everyone instinctively looked upward. Marcus muttered, "Don't you dare." The hospital generator held, power remained. Nobody spoke another word about it. Claire focused on the patient, something still bothered her. The blood pressure had improved slightly, the bleeding was controlled temporarily. Yet the oxygen extraction numbers weren't improving. That shouldn't happen unless… She leaned closer to the monitor. "Repeat the blood gas." The anesthesiologist blinked. "We just did one." "I know, run another." Within moments the results appeared. Claire studied them, her heart sank. The numbers confirmed her fear. The organs weren't receiving enough effective circulation. The body was surviving, barely but not for long. Patel looked over her shoulder. "What is it?" Claire pointed. "The tissues are starving." Patel understood instantly. "If we wait for Kim…" Claire finished the sentence. "There may not be enough left to save." Mercer overheard. "What are you suggesting?" Claire took a careful breath. "We have to begin the repair. You know this procedure." "I've assisted dozens." "Led?" "No," he studied her. "You understand the sequence, every step." Mercer looked at his own injured hand, then at the patient, then back to Claire. "I'll guide, you lead." Claire hesitated, not because she lacked confidence. Because crossing that line meant accepting responsibility for every outcome. She nodded. "Let's do it." Marcus quietly smiled behind his mask. In 27 years as a trauma nurse, he had never witnessed anything like this. A chief surgeon placing absolute trust in the very nurse he'd publicly dismissed less than an hour earlier. Claire extended her hand. "Clamp." The instrument touched her palm. The room watched. She didn't move dramatically. She didn't hesitate. She simply followed the anatomy. Steady, deliberate. Mercer's voice remained calm beside her. 2 millimeters left. She adjusted. "Good, hold there." She held. Blood flow slowed further. Patel carefully exposed the damaged vessel. "Perfect." The room exhaled together, then the heart monitor screamed. A piercing, continuous tone filled the room. The ECG changed instantly. "Ventricular tachycardia," the anesthesiologist shouted. The patient's heart was beating so fast it could no longer pump effectively. Pressure collapsed again. 38, 32, 28. Claire looked at the monitor, then at the surgical field, then back again. Her mind raced through every possibility. The vessel. The blood loss, the heart, everything was connected. She knew if they stopped now, they'd lose the repair. If they continued, they might lose the patient. Either choice carried terrible risk. She took one steady breath, then made the most difficult decision of her career. Nobody moves. The room froze. Claire's eyes never left the monitor. "Give me 3 seconds. 1, 2, 3. The rhythm changed again, not better, worse. The jagged waves dissolved into a single terrifying line, flat. The alarms merged into one endless tone. The anesthesiologist looked up, his voice barely above a whisper. "We've lost him." The flat tone seemed to swallow every other sound in operating room 6. No heartbeat, no pulse, just one relentless alarm. For a fraction of a second, even the most experienced people in the room froze. Claire didn't. "Start compressions." The command snapped everyone back into motion. Marcus climbed onto the step stool. "Beginning compressions." His hands locked together over Judge Wallace's sternum, driving down with steady, practiced force. The anesthesiologist reached for the defibrillator, charging. Dr. Patel irrigated the surgical field, desperately trying to maintain visibility. Claire looked at the clock. 12:17 p.m. Every second without circulation meant another second of oxygen deprivation to the brain. Mercer stepped back, cradling his injured hand against his gown. Instinct screamed at him to take over. His pride begged him to ignore the pain, but he knew something now that he hadn't known an hour earlier. Leadership wasn't always standing at the front. Sometimes it was trusting the right person to stand there instead. He looked at Claire. "I'm with you," she nodded once. "I know, rhythm check." Everyone paused. The monitor remained unchanged. Ventricular fibrillation, chaotic electrical activity, no effective heartbeat. The anesthesiologist announced, shock advised. "Clear." The team stepped back. The defibrillator discharged. Judge Wallace's body lifted slightly from the table. Everyone immediately resumed compressions. Nothing. Outside the operating room, Lisa Hernandez watched through the observation window with growing concern. She recognized the flat line. She'd seen enough medical emergencies during her years as CEO to know exactly what it meant. She quietly asked the nursing supervisor how long. "Less than 2 minutes. Lisa looked back through the glass. It already felt much longer. Inside, Claire's eyes darted across every monitor. Blood pressure, 0, heart rhythm, chaotic, end-tidal carbon dioxide, dropping. Then something caught her attention, not on the monitor, on the IV tubing, tiny silver bubbles. Hardly visible, she leaned closer. One, two, three, microscopic air bubbles drifting through the line, not enough to explain everything, but enough to ask another question. Marcus, he continued compressions. Yeah, switch. Another nurse immediately took over. Claire followed the tubing all the way to its source. Every connection, every valve, every stopcock. Halfway down the line, she stopped. One connector sat at a slight angle, not disconnected, not loose, just enough to create intermittent air entry whenever pressure changed. She looked closer, then farther. Something beyond it drew her attention. The rapid infusion system. A pressure valve wasn't sealing correctly. Each time blood products accelerated through the system. Tiny amounts of air entered the circuit, not enough to kill a healthy patient, but enough to worsen an already critically unstable circulation. Claire immediately clamped the line, replaced this entire setup. The circulating nurse hesitated. Now, the urgency in Claire's voice erased every doubt. Within seconds, a fresh infusion system replaced the faulty one. The anesthesiologist glanced at the monitor. Carbon dioxide's improving. Mercer frowned. Already? Claire nodded. He wasn't just bleeding. He wasn't being perfused properly. Mercer stared at the replaced equipment, the valve. It was making a terrible situation even worse. Patel whispered, "We would have never seen that." Claire answered quietly, "Neither would I, if everyone hadn't stopped talking." Another rhythm check. Still ventricular fibrillation. The anesthesiologist looked at Claire. Shock again. She looked around the room. Every face reflected exhaustion. Every gown carried blood. Everyone had given everything they had, yet one thought refused to leave her mind: the vessel, the repair, the interrupted circulation, the damaged heart. Then she remembered something Owen had once told her while building one of his robots. If one wire keeps disconnecting, don't keep restarting the battery. Fix the connection. She smiled beneath her mask. It wasn't about electricity. It never had been. She turned toward Mercer. "We're treating the rhythm." He nodded. We haven't finished treating the cause." His eyes widened. The partially repaired vessel, they'd stabilized it, not completed it. As long as blood continued escaping internally, the heart would keep failing. Mercer understood immediately. "We finish." Patel looked horrified. During CPR, Mercer looked at her. "It's the only chance he's got." Claire took a deep breath. "We repair while compressions continue." Nobody in the room had ever attempted this exact combination under these circumstances. It would require absolute coordination. One mistake. There wouldn't be another opportunity. Marcus looked at Claire. "You sure?" She answered honestly. "No." Then she smiled faintly. "But I'm certain standing still won't save him." That was enough. The operating room transformed again. One nurse maintained compressions with astonishing consistency. The anesthesiologist coordinated medications. Patel exposed the vessel. Mercer, despite his injured hand, guided every movement verbally. Claire performed the delicate repair exactly as instructed. 1 millimeter, she adjusted. Good, rotate. She rotated. Clamp, done. Suture, done. Every instruction came calmly. Every response came instantly. For nearly 6 minutes, the room functioned as though everyone shared the same heartbeat. Outside, headlights finally appeared through the heavy snowfall. Dr. Noah Kim jumped from the emergency vehicle before it had completely stopped. He sprinted through the emergency entrance. Snow clung to his coat. His hair was soaked. He didn't slow down. Inside operating room 6, the repair reached its final stitch. Claire tied the knot carefully. Mercer inspected it. For one long second, he said nothing. Then, "It's secure." Claire looked at the anesthesiologist. Check rhythm. Compress ions stopped. Silence. Everyone stared at the monitor. Nothing. Then one electrical complex. Another. A pause. Then a slow heartbeat. 38 beats per minute. Weak. Fragile. But real. No one spoke. The monitor continued. 42, 48, 56. The blood pressure climbed. 30, 45, 60. A pulse returned beneath the anesthesiologist's fingertips. "I've got him." No one cheered. Not yet. They all knew better. The heart was beating. The fight wasn't over. The operating room doors burst open. Dr. Noah Kim entered, breathing hard. "I'm here." Mercer stepped aside immediately. "You've got a repaired vessel." Kim looked at Claire. "You did this," Mercer answered before she could. "We all did." Kim examined the repair for several tense moments. Finally, he looked up. "This is excellent work." Claire exhaled for what felt like the first time in hours. Kim completed the final reinforcement, ensuring the repair would hold. Another 10 minutes passed. The monitors stabilized. Blood pressure climbed steadily. The bleeding stopped. For the first time since the surgery began, no alarm sounded. Mercer slowly removed his surgical mask. His eyes found Claire across the operating table. "I owe you an apology." Claire shook her head gently. "Later," he nodded. "Later." They still had one unanswered question. Judge Wallace's heart was beating again, but after so many critical minutes without effective circulation, would he ever wake up? The operating room was finally quiet, not because the danger had passed, because everyone was too exhausted to speak. For nearly 4 hours, every decision had balanced on the edge of disaster. Now, for the first time since Claire had whispered, "Stop," the monitors displayed something that looked almost ordinary: heart rate 72, blood pressure 108/66, oxygen saturation 98%. Judge Benjamin Wallace was alive. But no one celebrated. Dr. Noah Kim removed his gloves and looked around the room. "The repair is holding." He paused before adding the words everyone wanted to hear. "The rest is up to him." Claire stepped away from the operating table. Only then did she notice her hands trembling, not from fear, from the release of it. Marcus Bell quietly handed her a bottle of water. "You forgot to breathe for about an hour." She laughed weakly. "I think you're right," he smiled. "I've worked trauma for 27 years. She looked at him. "I've never seen anything like today." Neither had she. Across the room, Dr. Ethan Mercer sat on a stool while another physician cleaned and stitched the cut across his thumb. He watched Claire without saying a word. Earlier that morning, he had seen her as an interruption. Now he couldn't stop replaying every moment she had saved them. The warning, the pattern, the equipment failure, the hidden injury, the calm. She hadn't saved the patient because she was lucky. She had saved him because she had paid attention when everyone else, including him, had stopped looking. Judge Wallace was transferred to the intensive care unit. Claire followed the bed through the corridor until the ICU doors opened. As the team settled him into his room, the neurology consultant arrived. He completed a careful examination before looking at the family. Judge Wallace's daughter, Emily, clutched her father's wedding ring in her hand. "Is he going to wake up?" The physician answered honestly. "We don't know. He lost effective circulation for several minutes. The next 48 hours will tell us much more." Emily nodded, trying to remain composed. Claire rested a gentle hand on her shoulder. "We're not giving up." Emily looked into her eyes. "I believe you." That evening, Claire finally drove home through the snow-covered streets of Colorado Springs. The storm had ended. Fresh snow reflected the glow of streetlights across quiet neighborhoods. She unlocked the front door just after 8. The smell of tomato soup drifted from the kitchen. Her 12-year-old son, Owen, looked up from the dining table. "There you are." He hurried over and wrapped his arms around her. She hugged him tightly. "Tough day," he could always tell, "the toughest." He studied her face. "Did somebody die?" Claire knelt beside him. "We almost lost someone, but we didn't." Owen smiled. "Then it was a good day." She laughed softly. "Sometimes the good days don't feel good until they're over." After dinner, Owen carried his science project into the living room. It was a small robotic arm built from inexpensive motors and recycled parts. "Watch this." The arm picked up a plastic block, hesitated, then dropped it. Owen sighed. "It keeps missing." Claire watched carefully. "Can I see?" She noticed one tiny screw wasn't fully tightened. She adjusted it with her fingers. "Try again." The arm moved smoothly, lifting the block without hesitation. Owen grinned. "You always notice the little things." Claire froze for a second. Those exact words echoed through her mind. The little things, that was all today had ever been. Tiny details, tiny changes, tiny warnings. They had saved a life. 48 hours later, Claire walked into the ICU before sunrise. Judge Wallace remained unconscious. Machines breathed for him. The room was silent except for the steady rhythm of his heart monitor. She pulled up a chair. "I know you can't hear me," she smiled. "But families always ask us to keep talking. So here I am." She told him about the snow finally melting, about Owen's science project, about how the nurses were arguing over which cafe served the best coffee. She even admitted she'd probably lose the debate. As she stood to leave, she noticed the slightest movement. A finger, then another. She turned. Judge Wallace, his eyelids fluttered. She pressed the call button. Within seconds, the room filled with staff. Emily rushed in moments later. "Dad." His eyes opened slowly, confused, searching. Then they found his daughter. A tear rolled down his cheek. Emily broke into sobs of relief. Claire quietly stepped into the hallway. Some moments belong to families, not to nurses. 3 weeks later, the hospital's Quality and Safety Review Board assembled in the main auditorium. Doctors, nurses, residents, administrators, even paramedics filled the seats. Rumors had spread throughout the hospital. Everyone expected blame. Some expected lawsuits. Others expected disciplinary action. Claire sat near the back, hoping to remain unnoticed. Lisa Hernandez stepped to the podium. "Today's meeting isn't about assigning fault. It's about learning. She invited Dr. Mercer to speak. The room fell silent. Mercer approached the microphone, his bandaged hand visible to everyone. He looked across the audience before beginning. I've spent 30 years believing experience protected me from certain mistakes. He paused. I was wrong. No one moved. He continued. I dismissed a concern because of who raised it instead of evaluating what was being said. He looked toward Claire. That decision nearly cost a man his life. Claire lowered her eyes. Mercer wasn't finished. The person who demonstrated the greatest leadership in that operating room, it wasn't the chief surgeon. It wasn't the hospital administration. And it certainly wasn't me. He smiled gently. It was the trauma nurse who refused to stay silent when silence would have been easier. Every head turned toward Claire. She looked genuinely uncomfortable. Mercer extended his good hand toward her. Claire Donovan, would you please join me? She hesitated. Marcus quietly whispered, you've earned this. She slowly walked to the stage. The auditorium remained completely silent. Mercer faced the audience. Medicine has never been about titles. It's about judgment. It's about humility. And it's about having the courage to listen, even when the truth comes from the person you least expect. Then he did something no one in the hospital had ever seen. He removed the badge identifying him as Chief Trauma Surgeon. He handed it to Lisa Hernandez. I'd like this redesigned. Lisa looked puzzled. How? Mercer smiled. Every clinical badge in this hospital should carry the same words beneath the name. She examined the badge. What words? Mercer looked toward Claire. Patient safety comes first, not hierarchy, not titles. Not ego. The room erupted into applause, not polite applause, the kind that grows because people rise to their feet one by one. Residents stood first, then nurses, then physicians, finally the entire auditorium. Claire felt tears forming. She wasn't crying because she had been recognized. She was crying because she knew what that standing ovation truly meant. The next nurse who spoke up might not have to fight so hard to be heard. Several months later, the changes had spread throughout the hospital. Every operating room began each procedure with a new question. Does anyone see a concern we haven't addressed? No one entered surgery until every voice had been heard. The policy became known simply as the Claire Pause. Hospitals across Colorado requested copies of the protocol. Medical schools invited Claire to speak, not about heroism but about teamwork, observation, and the courage to question assumptions. She politely declined most invitations. She preferred being where she felt she belonged, at the bedside with patients. One crisp spring afternoon, Judge Wallace walked back into the hospital carrying a small wooden box. He found Claire finishing her shift. I've been looking for you, she smiled. It's good to see you standing. It's even better to be standing. He handed her the box. Inside was an old brass compass. It belonged to my father. He always told me that a compass isn't valuable because it shouts. It's valuable because it quietly points in the right direction. He closed the lid. You were that compass. Claire looked at the gift for a long moment. I was just doing my job. Judge Wallace smiled. No, you reminded everyone else what their job really was. That evening, Claire arrived home before sunset. Owen met her in the driveway holding a blue ribbon. I won first place. He proudly showed her the science competition medal. The judges said my robot worked because I paid attention to the smallest details. Claire laughed. Sounds like someone taught you well. He looked up at her. Mom, yeah. Did you fix someone today? She thought about the operation, the review board, the standing ovation, the new hospital policy. Then she smiled. I helped save one man. She looked back toward the mountains glowing in the evening light. But more importantly, I think an entire hospital remembered that the smartest person in the room isn't always the one with the loudest voice. Owen slipped his hand into hers as they walked toward the front door. Behind them, the last rays of sunlight reflected off the snow still clinging to the distant peaks. Inside the house, life continued with homework, laughter, and dinner waiting on the stove. Inside the hospital, another surgical team gathered around a patient. Before the first incision, the lead surgeon looked around the room and asked the new standard question, does anyone see something we've missed? A young nurse raised her hand. This time, everyone listened.